I'll hand it over to Marissa.
Great. Well, Hugh, you already heard most of the conclusions so for when we talked this morning. So it's wonderful to be here. Just let me see, what did I do here? There we go. Just for disclosure of the work I'm presenting, this was funded by CDC NIOSH. And while these groups did not provide funding, they were really instrumental and key partners in making sure this happened. And that was the US Coast Guard, the US Department of Transportation, the Marine Administration, and the Committee on the Marine Transportation System. This work was reviewed and approved by the University of Washington Human Subjects Division, but the opinions and conclusions I present are mine alone. And there I am on the Cal Golden Bear, which is a training vessel for the California Maritime Academy. So as we get started, I just want to say I love mariners in all forms. The baseball team, and this was actually at one of the Blue Jays playoff games. We won that one, but you all got robbed by the Dodgers. So I've always been a fan of mariners. And when NIOSH contacted me and said, we want you to work with mariners, I was hopeful they meant the baseball team. But I was actually pleased as I got into the work to learn about the mariner, the seafaring mariner, and how much I really enjoyed and loved that population as well. So that brings us to our first poll question. Wondering what percentage of goods you think are transported by water worldwide? All right, closed it.
Sure.
Okay, so we had about a three-way split between 41 to 60%, 61 to 80%, and more than 80%. And the correct answer is actually more than 80%. And the true estimate is probably closer to 90%. There is an enormous amount of trade and transportation that happens on the waterways. And, so as you can imagine, a large population supporting that both shoreside and at sea. But the group that we are interested in today is the mariner. And I'm, of course, coming at this from a very US perspective. There are similarities across the world, but there are also some key specifics about being a mariner in the US. But in the US, I'm talking about the US Merchant Marines. So these are civilian seafarers. These are not folks who are in the Navy or in the Coast Guard. And they move passengers and cargo between nations and within the US. They also operate and maintain tugboats, towboats, ferries, charter boats, excursion, and research vehicles. They could be employed by the government or by a private company. And even though these are not folks who are in the Coast Guard, they receive all their training and licensing through the US Coast Guard. There's the equivalent in Canada is the Canadian Merchant Mariners. So we're going to talk a little bit about the flags of vessels. So every vessel that sails in the world has a flag on it to show, what country they are sailing for or under. This vessel, as you can see, has a US flag. Others, you see all sorts of flags. And the importance of this is only those flags that have a US vessel or a US flag fall under the US rules and regulations. Vessels that have a Canadian flag, such as the BC ferries or some of your ocean-going vessels, they would fall under, the Canadian rules. And in the US, we have a very specific law for maritime, and it's called the Jones Act, and it was passed in 1920. And just a reminder that sometimes occupational health is shaped by regulations that are not related to safety and health, and this is one of those. So the Jones Act requires that any vessel that is US flagged and has that flag on their vessel, that vessel has to have been built in the US at a US-based shipyard. It has to be owned by US citizens. It has to operate under all US laws, and all officers and 75% of the crew must also be US citizens. Also, only Jones Act vessels, so those with US flags, can carry passengers or cargo directly between two US ports. So if you are ever taking an Alaska cruise and it leaves out of Seattle, the reason they all stop in Canada is, one, because Canada is awesome and people want to visit Canada, but also then they do not have to be a US flagged vessel. They do not have to comply with the Jones Act. If it was going just from Seattle straight to Ketchikan, it would have to be a cruise ship that was built in the US, maintained in the US, US citizens, etc. There is a Canadian equivalent. It's called the Coasting Trade Act. This was from 1992. One key difference is that the Coasting Trade Act does not have a requirement that vessels are built in Canada, but it does have requirements around the citizenry of the people who are sailing on the ship. So because of the Jones Act, this leads to a lot of ship owners sailing under what they call a flag of convenience. So a Bahamas flag or a Panama flag, because then they do not have to comply with the rules of the Jones Act. So in the US, there are 40,000 Jones Act US flagged vessels that support nearly 650,000 jobs. Those jobs include, the jobs that are on shore, the longshoremen, the other companies, other work that's on shore, but also the mariners. And about 200,000 there are about 200,000 licensed US mariners. And here's the answer to our question. 80 to 90% of trade worldwide involves waterways. And in the US, 76% of our domestic trade involves marine transportation. And that shocked me because I see a lot of Amazon trucks everywhere. And so I was surprised to hear that so much, even within the United States, is transported via waterways. Okay, so what is it like on a vessel? So it's a complex work environment. They have interesting hours and schedules. Sometimes they're working 12 hours on and then 12 hours off. Other times they're working 6 hours on, 6 hours off for a 24-hour period. But it's marked by kind of long schedules, atypical to a typical 8 to 5 schedule. There's physical demands with heavy lifting, lots of vertical ladders, confined and noisy spaces. They face extreme weather, heavy seas, and sometimes are carrying dangerous cargo. There's safety hazards related to the machinery, but also piracy, which is still quite relevant. They're living in close quarters to other people. It can be quite isolating. Often they have limited connectivity. And this can impact, of course, work-life balance when you are living in your workplace. It brings up challenges. And then, of course, there are social aspects as well. Like, what if you don't get along with your captain? What if you don't get along with your crewmates? What if you're being bullied? These are often pretty small crews. On the private vessels or on like a Navy vessel, it's kind of the barrack type living. But typically mariners do have their own rooms on the vessels. So what was it like on a vessel during COVID-19? Well, it was all of those things that I just talked about. That didn't go away. But mariners also weren't able to get on and off the vessels very frequently. It was harder for them to return home. They often had fewer people on each vessel. And there were lots of changes in work protocols, like having to quarantine before getting on or off a vessel, masking, cleaning, kind of all sorts of things. So it really compounded a lot of the issues that they already had. So that's what drew us to doing a US Mariner survey back in 2021 during COVID-19. And our goal with this survey, which was funded by NIOSH, was to characterize mental health outcomes, determinants, and barriers to accessing mental health care in US mariners, with the goal of prioritizing interventions to improve mariner well-being, both during COVID and beyond. So this survey was open for the start of 2021. And I will say, just to kind of orient people to what was happening, when this survey opened, there was still not a COVID-19 vaccine that was kind of widely available. That came basically in the middle of our survey. So that's the time period we are in. So we also followed up with a second survey, which just closed in 2025. And the goal of that survey was to still, once again, characterize mental health outcomes, determinants, and barriers to accessing care, but also to characterize some of the experiences that mariners have with harassment and discrimination on vessels, and to describe changes in workforce well-being since the immediate threat of COVID-19 has passed. So this was a follow-up to see if what has changed and if things had changed. You'll notice I don't have all the nice logos of NIOSH and CDC and DOT, and that's because this study was not funded by them. There was obviously a change in administration and different work was prioritized. So this was a PhD student of mine who took this on with support from some of those groups, but no actual money in hand. I'll also note that each survey included a single qualitative question, one question being, is there anything else you would like us to know about your experience with COVID-19 aboard your vessel? That was on our first survey. In our second survey, we asked, is there anything else you would like to share about mariner well-being or changes you would propose to improve well-being on your vessel? And I bring this up because what I'll be presenting on is a mixed methods study. So my next question to the group is, which of these below options best describe what a mixed methods study is? All right, we've closed the poll. And nearly everybody correctly identified that a mixed method study is a study that integrates both quantitative and qualitative data. And so that's what I'm going to be talking about here is those data. All right, so our survey topics, we used validated scales to assess PTSD, anxiety, perceived stress, depression, and suicidal ideation. We asked about workplace determinants of stress, job satisfaction and support, safety climate, general health and sleep of the mariners, mental health stigmas and barriers to accessing care. During COVID-19, the first survey, we asked about their concerns and experiences while sailing during COVID-19. And then in our follow-up survey, we asked about experiences with harassment and discrimination. So mostly I'm going to focus on the first survey. We received about 1,600 responses when we closed the survey. This was nationwide, so folks responded from across the United States. The large majority of our respondents were male and white and between the ages of 25 and 64. While this represents the US maritime industry, it would have been nice to hear from more racially minoritized mariners and female mariners to learn more about their experiences. Mariners self-reported good physical health, and they really like their jobs and the people that they work with. One key finding is that many mariners lack support and feel isolated on a vessel. and they self-reported decreases in sleep quality and mental health during the pandemic. One mariner told me, at times like these, the maritime professionals know for sure that our country doesn't care about our risks we are taking and continue to take to get critical products so that the country can operate. Our workforce isn't as large as most, but we are treated like criminals in our own ports and have no access to vaccines, although we are forced to have repeated contact with people who have been exposed to COVID. To get denied the ability to go ashore, but have 4 to 6 shore people come aboard in every port should not be allowed. Obviously, we need better lobbyists. So I see myself as a lobbyist for the mariner and their needs. So to show the prevalence of mental health outcomes in our population, it was higher than was expected. This is considered a very physically and mentally fit population. You have to have a medical clearance in order to get your credential. And that medical clearance involves not only physical health, but also mental health. So whenever I presented these results to folks in the industry, their jaws dropped at kind of the fact that the prevalence of mental health outcomes was quite higher than they expected and higher than in the general population. And you can see them there. Notably, more than half of our respondents screened positive for at least one of the above outcomes. However, I will say that this was not evenly distributed across our entire sample. We found that women, who was about 10 to 15% of our sample, and mariners on the younger end tended to be more likely to have one of these mental health outcomes. And this is really important for recruitment and retention. And that's what I tell the companies is like, you have to be recruiting young mariners. You need to be recruiting more women. And so this does represent a really important area for workforce development. We also found that certain jobs had higher rates, cadets, unlicensed engineers, so that's like a kind of equivalent of an enlisted non-officer, licensed engineer officers, and licensed deck officer. I don't expect you to know what these jobs do exactly, but just to note that there were notable disparities in what they do. And then also disparities in where these boats operated. So those that operate on the Great Lakes, military sea lift command boats, these are the boats that provide supplies to Navy vessels around the world, offshore energy support, NOAA research vessels, and harbor tugs tended to also have higher rates. And so this is kind of areas that we can think about, how can we make sure that they are getting outreach and getting served in order to improve mental health for these groups. And as I said, this is also an important area for recruitment. All right, this is our last poll question, but which of these groups had, on average, the lowest prevalence of mental health outcomes in my survey? All right, so most folks identified it was the older mariners. And when we were kind of hypothesizing why, part of it we think, it's kind of like a healthy worker effect, right? You don't stay a mariner unless you are enjoying that and you're able to, stay healthy doing it. Also, considering this was during COVID, we thought that maybe some of the younger mariners were more likely to have young children or, more disruption to their personal lives than maybe some of the older mariners who were probably less likely to have elementary aged children. All right, but we did want to dig in a little more to kind of what aspects of vessel life related to increased odds of mental health outcomes in our survey. So this was using logistic regression. That's why we're talking about odds here. But we found those with longer afloat tours, so people who were stuck on the vessel for a longer period of time and unable to get off. Those who reported feeling isolated on the vessel. Those who had increased worries about their contract length, money, or more concerns about the home front. So more worried about their family, friends, their life once they get off the vessel. Those who reported increased workload due to COVID-19 protocols, whether that was cleaning or how they were able to interact with people on the vessel. Those who had a self-reported lack of support or community on the vessel. We found a relationship between poor sleep and an increased odds of mental health. So those are kind of some of the key findings and some of those are more actionable than others. I do want to talk about mental health communication. So 65% of our respondents reported they received no communication or training on mental health during the pandemic. And one mariner told us, "The mental health training my company sends out is not helpful at all. It does not pertain to mariners. In one of the trainings, some of the tools they suggest to help with mental stress are talk to your family or go outside for a walk." Obviously, this is not applicable to mariners. So even if they were receiving information, they were not receiving applicable information. When we asked them what information they would like to receive, they told us they want to learn about warning signs to look for in others, what warning signs to look for in themselves, how to access help, and who to contact if they have concerns. Another mariner said there is a stigma with asking for mental health help in the industry. It is largely an attitude of forget your problems and work through it. Focus on your duties and you forget how you feel. There really are no resources available for mental health for commercial mariners at sea. My ship normally does a 90-day rotation. Some crew were there 6 to 8 months. It was the only time in my life I've truly experienced hopelessness. I'm truly surprised there have not been major accidents or incidents due to mental health and fatigue of crews when everyone is just trying to hold it together. 70% of our respondents also told us that they would not be able to start or maintain mental health care aboard a vessel. And a mariner told us, mental health care is a literal joke on board. There are no accommodations made. Even when management explicitly states that mental health care accommodations should and will be made, it is made clear by senior officers that any request will be denied and seen as negative behavior. And we found the reasons that folks identified as barriers to accessing mental health care. One is a lack of consistent internet and phone. More than half of mariners identified that. And I just want to go back to the Jones Act, because what I heard from a lot of mariners and ship owners is that we can't get internet in the vessel because we have to go to a US shipyard in order to get that installed, and it's too expensive, and the wait time is too long, and so it's hopeless. There actually has been a large uptick in Starlink now on many vessels. That is something that has changed positively since this survey, but there is still kind of connectivity concerns. People were also concerned they had no privacy on board to talk to someone. That was a concern. They were worried about losing their Coast Guard credential. There were concerns that, if I start taking medication or getting treatment for mental health, I'm going to lose my job. Also, that's not how they want to spend their limited off time on the vessel, and not even knowing where to start with finding a provider. So these are barriers, but these are things that we can overcome, I think, or that ship owners can overcome. Okay, I also want to talk about the qualitative part of this study. I've sprinkled in some quotes, but we did do a kind of a more rigorous qualitative examination. So we received 478 kind of usable qualitative responses. And we had 2 researchers who co-coded a subset of these responses. And then once we kind of had resolved discrepancies and agreed on the code book, we were able to code the rest of them independently and then come back and resolve any lingering discrepancies. We used both an inductive and a deductive coding approach to summarize responses into solutions and stressors. Solutions were loosely based on the hierarchy of controls. So that was the deductive piece, meaning that we applied an existing framework. Stressors were more inductively coded. We also looked at differences in common codes by age and gender. And this was my PhD student, Allie Clonch. This was her work. She had this published. So I get the joy of reporting on her findings. So the top 3 stressors that we identified from this content analysis. The first was that mariners were receiving inadequate support from shoreside. They illustrative quotes, "The rich people I work for don't think it affects them." Or, "It distresses me the non-support we receive regarding COVID. We are putting ourselves in harm's way by flying to board vessels, having pilots and vendors on board, and have not even received a letter thanking or acknowledging us. In my 40 years in the industry, I've never felt more isolated and without company support than I do now." This was actually the top code for the respondents who identified as male. The male respondents really felt like they didn't have shoreside support. There was also the second top code was inability to deboard relates to stress. I was stuck on a ship from early March until mid-August, most miserable experience in my life. Being trapped on a vessel without being able to go ashore is more stressful than the fear of getting COVID. And the lockdown has added to the already isolating situation vessel life is. No shore leave and long trips with possible extensions if crew members don't show is very stressful, both physically and mentally. This was the top stressor for females in our survey. And then the third was folks thought the COVID-19 controls were either ineffective or unnecessary. So I think it's crazy that we were locked down, not allowed to go ashore, yet contractors were allowed to come and go with just a temperature check and a questionnaire. We were exposed to the contractors every day, yet we could not go ashore. Or if we are quarantined before boarding and while on board, why must we wear masks in working environments to board the vessel? Or forced to wear a mask or be sent home. To wear a mask while a part of the bridge team is a joke and creates issues with understanding helm commands and radio transmissions. This was the top stressor for mariners who identified as being over the age of 55. And it's not a surprise seeing kind of big changes when they've been doing something a certain way for 40 years or so. Mariners also discussed solutions. Now, the nature of the question meant that solutions were discussed much less than stressors. However, some reoccurring themes included a lot of folks thought the existing controls were affected and they appreciated them. Folks wanted increased compensation given the changes to their work. They wanted increased worker flexibility. There was a group of folks who thought they should get rid of all the PPE rules, and a group who thought that the PPE rules needed to be enforced more and be stronger. They thought there needed to be more testing. There was, again, this need for public recognition and education. And then this whole area of creature comforts, with folks saying they want alcohol on board, they want better food, they want better internet, they just want a better experience. And actually, I was, as an industrial hygienist, quite proud because a few mariners also discussed needing improved ventilation. Not surprising, political themes were also apparent. So on the right here, people aren't worried about an illness with a 98% survival rate. They're worried about a government-mandated experimental vaccine unapproved by the FDA that hasn't been proven to protect anyone. The flu kills more people, but the flu vaccine has never been a requirement for employment. This needs to stop, and the country needs to get back to normal. On the left, a high prevalence of conservative identifying individuals in the towing and/or marine industry tend to not take COVID prevention seriously as a matter of identity. That includes individuals responsible for reporting, response, and coordination with the shoreside office. So we really saw both of these themes come through, with some mariners being, which was kind of reflective of what was happening in the United States as a whole. All right. So to get to the conclusions, what did we learn from this mixed method study? So notably that the proportion of mariners screening positive for adverse mental health outcomes likely warrants occupational health intervention. That rate was not evenly distributed, and it was high. Some of the common concerns that came up both in the survey and in the qualitative responses was a lack of access to shore leave, limited internet and phone, home front concerns, the ever-changing protocols and lack of communication, and lack of support from shoreside. We learned that there are many barriers to mariners accessing mental health care aboard a vessel. And despite having high job satisfaction, mariners don't feel support from vessel officers or company management around mental health. All right, so to move into the recommendations, one is continued kind of surveillance of mental health in this population. A cohort study would allow for longitudinal data collection, and we could also look at other markers of health as well. There needs to be appropriate training and communication around mental health for mariners on the vessel, and increased privacy on board for accessing mental health care. And I've talked with some companies about like, how can we set aside a spot on the vessel that mariners can access mental health care, but it's not necessarily like, you know, if someone is in there, like the light doesn't turn on, like someone's in here talking to a counselor. Or can there be people on the vessel who provide those services? How can we get these services to mariners? Or mental health care that can be accessed without internet or phone. That might be like an app that can kind of help triage major problems, but something like that. 48% of respondents said they don't have someone on the vessel to talk to. So increasing social support, making sure that there's, you know, everyone feels like they have someone to talk to could be valuable. Also, we need to focus on the needs of women and racially minoritized mariners. These are groups that had increased rates in our population. They struggle with other aspects of being aboard a vessel, but they are needed for a strong maritime workforce. And of course, you all know, as occupational health and environmental health students, the best solutions will change the workplace, not rely on worker behavioral changes. For a lot of maritime companies, it kind of starts and ends with, well, you need to exercise, you need to sleep more, you need to eat better. And I'm forever saying, no, no. You need to create programs and practices and support systems and not rely on the worker to take on more behavioral change. So what's next for us? My doctoral student is analyzing the findings from the 2025 survey, and she's investigating changes in proportion of respondents screening positive for mental health outcomes. These are different populations. We can't assume that people who took the first survey took the second survey. So it's, you know, we're just looking at kind of ecologic changes. We're looking at changes, whether there have been changes in access to shore leave and scheduling stability, which was a big concern in the first survey. We're also looking at experiences with harassment and discrimination on board and whether that differs between male mariners and female mariners and by race and ethnicity. We're looking at the health protective behaviors that mariners are taking. We've had about 600 respondents to this survey, but like I said, we can't assume that they are the same ones who responded to the first. So to end with a quote from a mariner, please take these survey results seriously and follow up with a proactive approach. I've circumnavigated the world 4 times, been to every continent during my shipping career, and have faced many high-stress situations, such as medical, fires, and personally almost falling overboard during a storm. Make no mistake, every single mariner has their mental health negatively affected when stepping aboard a ship. So I end with myself there in the captain's chair and 2 awesome cadet mariners behind me, and an acknowledgement of some of the really kind of key folks who have continued to make this work possible. Yeah, that was the end. Thank you.